I hope you're having a great day. This is Dr. Rob Lindsay at Vallejo Health and Wellness Center. And today I want to take a couple minutes and talk to you about constipation because it is extremely prevalent. Many of our patients that come here are constipated. And of course, many people out there in the world, I've seen different numbers from 1 out of every 4 people in our country potentially have constipation. So here's the deal. Why do we even care about it? Well, the thing is that it's not just about a person being repeatedly, bloated or having pain or getting hemorrhoids. Yes, those are problems, but when you have a slow transit time or slow movement through that colon, over time it can lead to some serious issues. For example, if you can't poop, okay, you can't get rid of toxins, and those toxins, those are the waste products from all kinds of physiologic responses that have occurred. And if you can't get rid of that, your body will actually reabsorb it through the wall of the colon into the bloodstream, and it will circulate, and then your body becomes overly toxic, and this can lead to other health problems. So what is it really though? Okay, so a lot of people think of it as when you just, you're straining to go to the bathroom or you have a hard poop. But the thing is that those particular symptoms don't always mean you're constipated. Instead, we prefer to look at this chart. It's called the Bristol Chart. And with the Bristol Chart, it has from the top down, it has what's called slow transit to rapid transit. So on the top part, there's type 1 and 2, and those two types, if you're passing stools that are type 1 or type 2, then you're constipated. And even if you are going regularly or you have occasional diarrhea, you actually have constipation. Where we really should be is in stage 3, where it's like a sausage, okay, or 4, where it's more like a snake, and smooth and soft. So I know people don't like to talk about their poop, but it's really important, and you should look at it and see how it compares to this chart. So the stool form actually correlates with intestinal tract transit time, okay? So constipation is actually slow transit time. Things are moving too slow. Well, here's some of the problems though. When you have constipation, some of the side effects that can occur and the first thing to know is that there's an underlying root cause to this. Okay, constipation just doesn't fall out of the sky. There is a reason, and you really need to dig to find out what's causing it. And if that root cause, the real reason, is not identified and treated, it can lead to some long-term serious health problems. So in the short term, symptom management can be used, okay, but treating the underlying root cause is really the reason of what we should try to do, okay? So now, what are some of these side effects? Well, as you can see on the list, number 1 is probably fatigue. Well, guess what? Fatigue is the number 1 concern or complaint when a person comes to my office, no matter what kind of diagnosis they have, whether they have an autoimmune disease like Hashimoto's disease, whether they have irritable bowel syndrome or fibromyalgia. People will always say, Doc, I'm fatigued. I'm tired all the time. I can't muster enough energy to do the kinds of things I love to do. Number 2, weight gain. Okay, really, people start to gain this weight. It can be around the belly, but also all around the body due to this constipation. Bad skin. People get acne. They can get eczema. They can get just interesting bumps and things like this in different parts of the skin. The small intestine bacterial overgrowth. Now this is a whole different condition, but that can be one of the effects. We'll talk about that one in a minute. Your immune system can be affected. 70 to 80% of your immune system is within your gut. And when you have constipation, because of the toxins that get reabsorbed, it will affect immune function. Hormone imbalance is another, especially what we call estrogen dominance in women. Also, it can happen in men as well. You can end up with structural conditions like back problems, okay? People a lot of times have back pain due to a chronic constipation, from the colon. You can get impacted fecal material where almost nothing will help you to get it to move short of some, pretty potent medications. Also, it can lead to anxiety and depression. So these are just some of the 10 common side effects when a person's constipated. Now let's look at some of the real causes of constipation, okay? And we used to think, and I was taught in school that constipation was really just about bad lifestyle choices. And if you ate enough fiber and you got enough water and you were exercising enough, then you wouldn't be constipated. But I have people who come in my office who are drinking plenty of water, they're actually eating well, and they're actually exercising, and yet they're still constipated. So there are some other things that can lead to this, and I want to go through those now. So one of the first things are food intolerances. Okay, this is where you eat a food and you have an immune reaction or some kind of a reaction in your gut, and it activates your immune system, which causes inflammation. And inflammation actually, well, it affects your gut function, and it affects the muscles that are there to squeeze and do what's called gut motility. They actually are what help to propagate that stool through the colon. So food intolerances can affect that negatively. Also nutrient deficiencies, and this is a common one people would think of, but a few things people don't think about all the time are blood sugar imbalances. Okay? Blood sugar is what we call a deal breaker. If it's off, no matter what kind of health problem you have, it's going to be hard to fix that health problem if you don't have a nice stable blood sugar that's not dipping and spiking. Mineral deficiencies. You think about calcium, you think about potassium, you think about other minerals that are involved in gut motility as well. Digestive deficiencies like hydrochloric acid or a decrease in digestive enzymes. If you don't have those, it will affect your motility. And essential fatty acids like you would get from eating fish oils. Other things that can cause this include bacterial infections, and I run into this a lot with people. There's a couple main things. One I want to point out here is the small intestine bacterial overgrowth, and what that means is that it can mean that you have the right bacteria, but they're in the wrong location. Bacteria that come from the colon can actually go up the chain into the small intestine where they don't belong, and they create a lot of bloating, a lot of distension, and that can affect the propagation of the stool through the bowel as well. And that can crowd out the beneficial bacteria that we all need within our gut. The other thing are certain types of bacterial infections, like we find what's called H. pylori within the GI system. And H. pylori is a really common cause of gastric ulcers and gastric cancer and heartburn and other things that can affect colon as well, and constipation. Other things that we find often, and these are really common, parasites. Okay, other types of fungals as well, like candida, can be within the colon or in other parts of the body. And remember, hey, everything connects everything else. So we can't just look at your colon, we have to look at your whole system. But intestinal parasites are often found within the colon as well. They can be single cellular, like what an amoeba, which you might get from something called Giardia, also known as beaver fever. Or you can have more of what this picture shows is more of a worm, and those worms, they take from you, but they don't give anything good back, and then they have to poop too, only theirs is toxic. So their poop can circulate through your system and cause other health problems. Viral infections can also be within the colon, as well as, this is really common, heavy metals. The most common that we find are mercury, lead, aluminum, arsenic, and cadmium. And you may wonder, well, where would I get these? Well, mercury from silver fillings and from eating fish that was contaminated, lead from lead-based paints, from gasoline residues from back in the 70s. It's sometimes in the water supply. Same with arsenic. Cadmium we often find within herbicides and pesticides. So it's not that hard to get exposed to these metals. Other things, chemical toxins. These are some of the really common ones. Pesticides and herbicides. Look, they're spraying it on the food. Okay, it's on the food. You can't wash it off. It's embedded within your foods. Other things like personal care products, hydrocarbons from industrial waste, formaldehyde, which off gases from carpet and from furniture. Benzene, which is an aromatic hydrocarbon that is in a lot of different, other chemicals. Household cleaning equipment. All this stuff we're breathing in, we're getting it on our skin, it's going in our mouth. It has the ability to get in and affect our colon. Medications are another common cause. So if you've had antibiotics, well, what do? They kill the good bacteria as well as the bad bacteria. And by the way, we find these in people even decades after they've had them. Vaccinations, the residues from the different types of chemicals that are in the vaccinations. Other types of medications, birth control, antidepressants, blood pressure meds. These can cause constipation. Look on the label and you'll see side effects. Constipation being one of them for many of these drugs. Also, radiation is something that we can find in there. EMF radiation from like cell phones and Wi-Fi, as well as X-rays. I just had a patient a couple of days ago, and he'd had back surgery, and now he's full of hardware because they had to do some stabilization. The point is, though, as I was testing him, I found X-ray radiation in his colon, and he's getting heartburn and constipation. Okay, that's pretty interesting, right? We also find radon. Radon is a radioactive gas that's in the earth, and it seeps up, through the ground into homes commonly. So those are some of the radiation, causes. And then we can't forget about just the chronic stress that we have in our country. The people are stressed out. They've got physical, chemical, emotional, spiritual stresses. And this stress can affect what we call the gut-brain axis. So when the brain or the body experiences stress, because there's a two-way communication pathway, both systems can be affected. The brain can influence the gut by causing a decrease in that gut motility, a decrease in the propagation of those muscles that are supposed to squeeze the poo out of your body. Also, it can lead to microbial imbalances, okay, that good bacteria that we need. People take probiotics to help it. But then when that's out of balance, those can affect neurotransmitters and your mood. So people end up with anxiety, depression, bipolar issues. It's all connected. So the way I would like to refer to this is that if a person has constipation, they really have what we call a web of physiologic dysfunction. There's never just one thing. There's usually multiple systems that are affected and that affect it. So constipation can affect the thyroid, and the thyroid can cause constipation. This is why we have to look at you as a whole person and not just as a person who's got constipation. This is the crux of what we're trying to get at in everything we do here at Vallejo Health and Wellness Center, that we have to be able to dig and look through all the systems of the body, and we have to really look at what is causing this thing. We can give you remedies and supplements till the cows come home, but if we don't find and remove the cause, we're going to hit our head against a brick wall. So I do want to give you some ideas, though, some things you could do that might help you for the short term. Some strategies to help you get clear of constipation. Number one, more fiber, right? That can come from fruits and vegetables. You can also take a couple of products, like Premier Research Labs has a cleanse, and then a product called Sun Fiber. Those can really help. As well as, magnesium and vitamin C. And if you take 500 to 700 milligrams of magnesium citrate and 1,000 to 1,500 milligrams of vitamin C once or twice a day, that can be a powerful 1-2 punch to help you get your gut moving and get your colon moving. And by the way that I recommend these is that you start with number one, and if it doesn't work after a day or two, then you maybe add in number two, and then you might add in number three, like prune juice. Good old-fashioned prune juice often will get those things going, but again, it doesn't get to the cause. Another good one, senna tea. So senna is an herb, and there's this stuff called smooth move tea. It's tea, it's herbal, and you take it once before bed, and usually a person will kickstart their colon, and their constipation will get moving in the morning. Also, this is one of my all-time favorites. It's called aloe pharax. Aloe pharax is a plant in the same family as aloe vera, of course. It's native to South Africa, so very limited place you can get it. But it's an herb, and boy, can it get people going. And there's a very fine line between one too many capsules and it causing diarrhea. So you have to start low and work your way up. A coffee enema can be a powerful way to get the colon moving because it helps to cleanse the liver, and it stimulates what's called the vagus nerve, which is one of your cranial nerves, and that particular nerve helps to propagate that muscle contraction. So the vagus nerve we're going to talk more about here in a second. Vagal nerve stimulation. How do you do this? Well, you can gargle like this woman is doing here with some water, and you have to gargle very forcefully, enough that you actually bring a tear and your eyes water up. You also can gag yourself with your toothbrush, put it on the back of your tongue, press down gently, and elicit the gag reflex. And the reason that works is because the nerve that controls the gag is called the hypoglossal nerve, and right next to it in the brainstem is the vagus nerve. So when you stimulate the hypoglossal nerve, nerve pools from it will stimulate adjacent nerve pools from the vagus nerve, and the vagus nerve actually goes all the way down to the colon. So if you can do these exercises as well as, say, humming or singing really loudly, those things can actually, you do them every time you go to the bathroom, and over time it will powerfully stimulate your vagus nerve. So if these strategies aren't enough for you, or you really want to uncover the root cause to constipation, you may want to consider getting specifically tested by a functional health doctor, and that's where we can come in and help you. So if you decide to do something like that, our first action step is that you've got to set an appointment, and you just call the office, 952-949-0676, and you set an appointment, and you say, hey, I want to come in and get checked. Number two, you'll want to go to our website, and you're going to want to watch a video called Your First Visit. 5 minutes long, really help you to understand what we're about. Number three, you want to get all your paperwork done in advance and sent in so that the doctors here can look at it thoroughly and have a great idea about what's happening with you before you even come in. And action step number four is that after that very first visit, where we do a thorough consultation, a history, and an exam, we're going to want to get you to come back in for a report of findings visit, where we'll go through all of the details about what we found, what we think we're going to have to do to help you, how long it's going to take, and the cost. So we'll set that appointment, and we ask that you bring your spouse or loved one, somebody who's going to support you through your care. So here's the kicker. Even if you're on the right track, you'll get run over if you just sit there. So this is your call. Pick up the phone, give us a call, come on in and see if we can help you get rid of this constipation once and for all. Thank you. Have a great day.